Whatever it is that your story is, it's perfect in your head. And then real life happens, and it's never perfect for anybody. When you have difficult times, you need therapists, you need doctors, you need to build a village. And these people are my village. They've just made it personal in a way that you know they care. The gratitude that I have goes way farther than I think they know. I love them so much.
If you look back, this hospital was started by folks raising money to build a community hospital near home so they didn't have to go to Cleveland during the flu epidemic after World War I.
A long time ago, they went to work and made that happen. I'm sure they couldn't even imagine it growing and staying independent for this long.
Our job as stewards is to continue on that. As an independent hospital, that means we make our own decisions, and I think we're a little bit more responsive to the people in the community that we serve.
A spirit of independence can really fuel the spirit of innovation. Here at Southwest, innovation manifests itself when anyone raises his or her hand and says, I think we have an opportunity to do something even better. It's just part of the culture.
It's a very unique situation here. It's a great place for a physician to practice medicine so that he or she can practice medicine the way they envision it. It makes me want to be a better doctor.
It is a culture that we've maintained here over the years because we treat every patient like they are our own family. People come here to be cared for not as a number, but as a person. Our biggest job is to make sure that they feel safe and comfortable.
Our story went off the rails. I am a stay-at-home mom, which means stay at therapy and stay at appointments and stay in the car. So I often joke around and say I'm a stay-in-the-car mom. When you have kids with special needs, it's hard. I see that they struggle every day. I don't want to cry, but it's really difficult because I don't know if my kids will ever crawl. I don't know if they'll ever walk. I don't know if they'll ever talk to me. But you got people here that are like, we're gonna work our butts off and we're gonna do what we need to do. We know your kid. We love your kid. We see your kid multiple times a week. We know he's going to make it to this step. It's not just my kids that they're helping. They're helping me, and the sense of community is amazing. It gives you hope.
The community does look at us as their community hospital. They use us for their health care, they use our physicians, they use our services. They give back to us at the hospital. We have over 500 volunteers.
It's just amazing. They're like an army of individuals that are helping to keep our hospital work more efficiently. Lou, one of our volunteers, he's in his late 80s. He's volunteered over 10,000 hours.
I have several friends who are in their 90s, and they are still going over to the hospital to volunteer. They feel like it's something they can do to help the people in the community.
There's this sense of ownership, responsibility, that we need to keep this hospital around for years to come. And when I say hospital, I'm not just referring to the bricks and mortar of our building. I think our hospital is permeating into these communities, whether it's programs through the rec center, senior center, or in the schools.
We do so many things out in the community, even march and the parades for many, many years.
Our hospital has done a nice job of keeping the pulse on what's current, but more importantly, the communities have also rallied and helped us to build our physical campus as needed. I mean, several years ago, we had a nice capital campaign, which built the Pandrangi Tower. Now we're trying to raise some monies for the enlargement of our maternity services. Everybody's coming to the table and they're willing to chip in, and this is their hospital, and they show it.
I want to give back because Southwest is my hospital. We are so lucky to have such good care so close to home. It's really one of our great assets.
Since the founding, this institution has been blessed. That shows the commitment to have this hospital succeed. And I think that is a very, very special.
What makes us special at Southwest General is our people. Our employees, our physicians, our volunteers, the people that come into the community that help support us. I get excited about that, and we're doing great work. My job is to help provide that vision of where we need to take the organization, and our folks are doing a great job of executing that.
It takes a lot of diligence, a lot of patience to keep all of that together, to keep all of these staff working together with the same caring culture.
Clearly, the people that work here, they want to be here. So it's not people are just punching in and punching out. A lot of multi-generational family members work here. So a father might work on one floor and the daughter works on the other floor. Brothers and sisters work here together. There's a steep tradition here and everybody chips in and it's one big team.
Having those people is so important because what we do is very important. And there are times where we're literally working on someone and trying to save their life. You have to be able to count on those other people, not only their skills, their abilities, but you feel as though you can rely on that person next to you where you're never by yourself.
We are all on the same boat. We want to provide the highest quality of care to our patients at the lowest cost that is possible. And then patients are fully satisfied and we want them to have a great experience coming to Southwest.
They have no idea the impact that they have on my life. They have no idea how much they're helping me and my children. Wherever they go, will have a lot of appreciation for this place because I know that they'll have a big part in how far my kids go.
People need to know how warm and reassuring it is when you're being taken care of there. They really do care about you at Southwest.
We definitely do a good job taking care of the acutely sick people. But I think the administration here is looking 10, 20, 30 years down the road, which means we have to focus on the overall wellness of the patient.
The care is evolving now. It used to be more patients were cared for on an inpatient basis. Now things are moving to the outpatient side. And actually, we're now sending providers into people's homes to help keep them healthy. We're providing wellness programs to help them eat healthier, be more active, be more fit, live a healthier lifestyle.
We need to continuously educate our communities what is best for them so that they can live a long, fruitful, fulfilling life.
Through the years, we've changed and evolved as an organization, and we're going to continue to do that to make sure that we're meeting the healthcare needs of the people, not only today, but in the future.
We all have to adapt to the change. We all have to move forward, but not forget about how far things have come and also the simple things that should never change.
One thing that is a constant is the person at the center. That will stay the same.
And if we keep this vibrancy going, Southwest will be a very relevant institution for next 100 years.